Harvesting and Storage Strategy 2020-2025. Honorable Speaker, pursuant to the provisions of Standing Order 44-2C, I wish to request for a statement from the Chairperson of the Departmental Committee of Blue Economy, Water and Irrigation regarding the status of implementation of the National Water Harvesting and Storage Strategy 2020-2025. Honorable Speaker, the collection and the management of flood water, storm water, and drain water is essential for reuse during periods and also episode of drought. The National Water Harvesting and Storage Authority, which was established through the Water Act Cap 372, is mandated to undertake the development of national public water works for water resources, storage, and flood control on behalf of the national government. Additionally, the Ministry of Water, Sanitation, and Irrigation developed the National Water Harvesting and Storage Strategy 2020-2025 with the aim of reforming the water sector by increasing water harvesting and storage for domestic use and reducing water-related risks for the population and economy, among others. Honorable Speaker, the Tana River region experiences extreme weather cycles throughout the year, with the residents experiencing floods and heavy rains in upstream areas and extreme drought in the region in equal measure, particularly Masinga area. This has in turn adversely affected the residents and their livelihoods that depend on crop and livestock farming. Honorable Speaker, it is against this background that I seek for a statement from the Chairperson of the Departmental Committee of Blue Economy, Water and Irrigation on the following. Provide detailed report on the status of implementation of the National Water Harvesting and Storage Strategy 2020-2025 in the country, and specifically in Tana River Basic Region. The mechanism being implemented to build resilient and communities within the Tana River Basin and assist them to mitigate the effects of floods during and after heavy rainfall, and steps being taken by the ministry through National Water Harvesting and Storage Authority to develop disaster management infrastructure, including construction of irrigation tunnels in Masinga constituency and the other identified flood-prone areas. I thank you, Honorable Speaker.
Chair, Blue Economy, Water and Irrigation. Yes, Mukunji. Hold on, Boyd.
Chair, I just wanted to comment on...
Which chair?
Oh, sorry. Honorable Speaker, thank you. I wanted to actually add my weight to that statement.
But you know, Mukunji, ordinarily,
yes,
we don't allow joyriders on statements.
it's good to issue comments.
Questions.
Yes.
Yes.
But, Honorable Speaker, it's a shame that this country still reels with poverty and lack of water in many areas when God has blessed this country with a lot of water in rivers and in rain, Honorable Speaker. And I want to say that I propose that board to either be disbanded or they do their work in terms of water collection so that we don't continue importing our foods when this country is blessed with water. Thank you, Honorable Speaker.
Bowen, 2 weeks.
Mr. Speaker, the statement by Honorable Mwale is very important and it requires a very comprehensive answer. Mr. Speaker, as you have heard even from the Honorable Mukunji, I request for 4 weeks Mr. Speaker, and I will bring a very comprehensive answer.
Bring in 3 weeks.
Thank you, Honorable Speaker.
Honorable John Mwirigi.
Thank you, Honorable Speaker. I request for a statement regarding Kemri investigation into eye cancer prevalence in Meru County. Honorable Speaker, pursuant to provision of Standing Order 44.2c, I wish to request for a statement from the Chairperson of Departmental Committee on Health regarding the status of the report by Kenya Medical Research Institute on the probe into high prevalence of cancer in Meru County. Honorable Speaker, the Kenya Medical Research Institute, KEMRI, is a state corporation established under legal notice number 35 of 2021. The institute is responsible for, amongst other roles, carrying out research on human health in the country. In 2020, KEMRI undertook an investigation in the high prevalence of cancer in Meru County, specifically in Akachu and the Kiegoi locations in Igembe South constituency. The research was prompted by the distressing frequency of cancer-related death and ongoing suffering of Meru County residents battling various forms of diseases including throat, breast, tongue, eye, mouth, prostate, and prostate cancer. The primary objective of the research, including advancing the understanding of the underlying causes of the prevalence of the cancer in the region and enhancing preventive strategies. However, it is deeply concerning that 4 years since the commencement of the investigation, KEMRI has not released any findings or progress report on the matter. Honorable Speaker, it is against this background that I request for a statement from the Chairperson of Departmental Committee on Health and on the following. A comprehensive report on the findings of the 2020 investigation into the high prevalence of cancer in Meru County and specifically Igembe South constituency, including the identified causes or risk factors contributing to high cancer rate. And number 2, the immediate and the long-term strategies the government plans to implement to curb the rising cases of cancer in Meru County. I thank you.
Chairman Health, Dr. Bukose, 2 weeks.
Honorable Speaker, the member for Igembe South has asked for a comprehensive report. I'm aware of the research that was carried out, which was a data collection from that area of Maua. So, but they have not done, and it was in collaboration between KEMRI and the county government of Meru. We've not been able to fund them adequately, but I'll be able to provide that data which they have collected, maybe in a period of 2 weeks.
2 weeks it is.
Yes, but it will not be very comprehensive because of the limited resources and the time for what they did.
Dorothy, what is it? I said no joyriders to statements. What is it you want to say?
Honorable Speaker, I beg you allow me a hand to what Honorable Mwirigi has said. Indeed, cancer is the greatest killer of our people. And Honorable Speaker, I did raise a statement here one time that the only cancer center that was supposed to help the Meru people was the Dadan Kimathi Cancer Center, which is stored many years back. Honorable Speaker, I want the chair to take this with the urgency so that our people can be at least assisted because they are dying in their numbers. Thank you, Honorable Speaker.
Yes, because...
Honorable Speaker, I wanted to inform the Honorable Member that the government is in the process, the national government, in collaboration with the county government in setting up a regional cancer institute in Meru. The Tetan Kimathi will be for Nyeri. So for Meru, we'll do the regional cancer center in Meru. And if the members propose, we could put it even in Maua.
Robert Mbui, no. You will
thank
get an answer, yes. Hold on, Robert. Yes, John Paul. Give to John Paul the mic.
Thank you, Speaker. Speaker, I wanted to beg you, according to the chairman has said that the report which he will give in 2 weeks' time will not be that comprehensive. And according to this matter is a very weighty matter, Chairman, Mr. Speaker. It's good for the chairman to tell us what maybe do he require from this house so that he can bring a comprehensive report.
Let's see the report when it comes. We'll judge whether it will be comprehensive or not. Boy, Robert, member
thank you.
for Kadian.
Thank you, Mr. Speaker. This is a request for a statement regarding payment of last expense, stroke group life claim to the parents of a deceased child in Kadiani constituency. Honorable Speaker, pursuant to the provisions of Article of Standing Order 44.2c, I rise to request for a statement from the chairperson of the Departmental Committee on Health regarding payment of the last expense group life claim to the parents of the late Willie James Muo, a parent of Nduguni Secondary School. Honorable Speaker, it is unfortunate that upon the death of the minor, and that is Willie James Muo, on 14th July 2023, the parents have faced great challenges with regard to processing of claims for the last expense and group life benefits provided under the Edu Afya scheme. The parents followed the required procedures in filling the claim, but were informed by the National Hospital Insurance Fund, NHIF, that the payment could not be made to them as a unique personal identifier, UPI number, assigned to their deceased child was erroneously allocated to another student in NHIF records. They were then referred to the Ministry of Education to request for rectification of this error and ensure harmonization of the UPI number on their systems. Honorable Speaker, the Ministry of Education confirmed to the parents that the UPI number indeed belonged to their deceased child and was not erroneously assigned to any other student. Despite this confirmation, the parents have continued to face obstacles in obtaining their rightful compensation, and efforts to harmonize the UPI numbers within the NHIF system have been in vain. Honorable Speaker, it is against this background that I seek a statement from the chairperson of the Departmental Committee on Health on the following. 1, what steps have been taken by the Ministry of Education to resolve the UPI number discrepancy in the records of the NHIF? 2, provide the timelines within which these issues shall be resolved and the parents of the late Willie James Muo compensated. And 3, state the measures that are in place to ensure that there is collaboration between NHIF and the Ministry of Education so that we ensure that UPI numbers assigned to students correctly reflect in their systems. And Mr. Speaker, I'll further follow up on the issue of Edu Afya going forward. Thank you, Mr. Speaker.
Thank you. Chairman, 2 weeks.
Honorable Speaker, I'll give a response in 2 weeks, and I'll also be able to respond to Edu Afya. As you know, the Cabinet sat and approved that Edu Afya will continue. So we want to assure the parents outside there that they should not worry the children in school, and even it is extended because even those in the lower classes will also be covered. So I think it should not be something to worry about.
Chief Foromondo Mangale.
Thank you, Mr. Speaker. Honorable Speaker, pursuant to the provision of Standing Order 44.2c, I rise to request for a statement from the chairperson of the Departmental Committee on Labor regarding the gazettement of Lungalunga Sub-County as a hardship area. Honorable Speaker, hardship allowance was introduced as an incentive to teachers and other public officers working in remote areas to compensate for lack of basic amenities such as hospitals, poor infrastructure, harsh climate conditions, and communication access. Sadly, Lunga sub-county is an area where teachers are forced to travel long distances to access medical services, proper housing, and other basic amenities. These challenges have resulted to many of the teachers working in Lunga sub-county seeking transfers to other areas with better working conditions, leading to insufficient number of teachers in the area. Honorable Speaker, a country-wide data collection exercise aimed at reviewing the hardship area was led by the Interagency Committee with representation from different ministries, state agencies and commissions. The Interagency Committee, in its report of 17th September 2021, listed Lunga among other areas to be gazetted as hardship areas to allow for enhanced allowances of public servants, including teachers. Despite the proposal, Lunga sub-county is yet to be gazetted as a hardship area. Honorable Speaker, it is against this background that I request for a statement from the chairperson of Departmental Committee on Labor on the following. 1, the measures in place by the Ministry of Public Service, Performance and Delivery Management to ensure the gazettement of Lunga sub-county as a hardship area and provide details on the timelines to be taken for the gazettement of the area. And 2, the reason as to why there has been delay in implementation of the recommendation of the Interagency Committee that Lunga sub-county be gazetted as a hardship area. I thank you, Honorable Speaker.
Honorable Chief Oromondo, are you sure you've directed your question to the correct committee?
Yes, Mr. Speaker, because then the matter is before the Minister of Public Service, which is, in most cases, is handled by the Departmental Committee of Labor.
Okay.
Yes, sir.
Chair Labor? Is it Karemba? I thought so too. Karemba, Owen, inform them to bring the statement response in 2 weeks.
Okay. Much obliged.
Joseph Lekuton.
Okay. Thank you, Mr. Speaker. Mr. Speaker, pursuant to the provisions of Standing Order 44(2) Section C, I wish to request for a statement from the chairperson of the Departmental Committee on Transport and Infrastructure regarding erosion of the Serima-Loyangalani Road. Honorable Speaker, for generations, Lake Turkana has been a vital resource for the economic and cultural well-being of the residents within its environment, including the El Molo community, which is considered as the smallest community in this country, Mr. Speaker, and the most indigenous. Regrettably, the rising water levels in Lake Turkana beyond its banks has eroded critical infrastructure over the years, such as the Serima-Loyangalani Road, rendering it impassable. This situation has worsened the supply of goods and services in the area. Honorable Speaker, it's against this background that I seek to request for a statement from the chairperson of the Departmental Committee on Transport and Infrastructure on the following. A detailed report on the urgent measures being taken to ensure the Serima-Loyangalani Road is rehabilitated, urgent measures being put in place to ensure all affected residents receive food and basic amenities, and, Mr. Speaker, steps being taken to ensure that the water from Lake Turkana is reusable for agriculture in the surrounding semi-arid areas. I thank you, Honorable Speaker.
Thank you. Chairman, Transport and Infrastructure. GK.
Thank you, Honorable Speaker. I request for 3 weeks to respond to that statement.
You can do it in 2 weeks?
Yes, but if you give me 3,
The
I
honorable
appreciate.
member.
I have more, many
The
more
honorable
statements.
questioner came to the Speaker's chamber very agitated about this issue.
Okay.
Yes. You better consult with him
Yes.
and bring a response in 2 weeks.
I'll do so,
Yes.
Honorable Speaker. Thank you.
Honorable members, before I call the next, allow me to acknowledge the following institutions in the Speaker's Gallery. Kapsabet Girls High School Mgwen in Nandi, Kemeloi Boys High School from Aldai, Nandi. On behalf of the House and myself, we welcome the students, their teachers, and whoever else is accompanying them to the House of Parliament. Thank you. David Kiplagat, DK.
Thank you, Speaker. Request for a statement regarding the expansion of Leseru Kitale Kortum Highway. Honorable Speaker, pursuant to the provision of Standing Order 44.2c, I wish to request for a statement from the chairperson of the Departmental Committee on Transport and Infrastructure regarding the expansion of the Leseru Kitale Kortum Highway. Honorable Speaker, the Leseru Kitale Kortum Highway, a critical link of the Kenya-South Sudan Road Corridor, has been in dire need of rehabilitation and expansion, including providing for climbing lanes. The narrow highway has caused significant challenges to road users and pedestrians. The road is in serious state of dilapidated and requires rehabilitation. These challenges have severely affected residents by disrupting and hindering the flow of goods and services within the area. Additionally, the narrowness of the road has led to accidents resulting in the loss of life. Honorable Speaker, it is against this background that I request for a statement from the chairperson of the Departmental Committee on Transport and Infrastructure on the following. Measures being taken to address the safety concerns of the residents regarding the dilapidated and narrow state of the Leseru Kitale Kortum Highway. 2, the relief measures the government is putting in place to compensate the families of the residents who have lost their livelihood through accidents as a result of the narrow state of the road. And lastly, the long-term plans being implemented to rehabilitate and expand the said critical road, including the current plans, if any, to secure external funding for development of the road. I thank you, Honorable Speaker.
DK, Chair, Infrastructure, Transport.
2 weeks, Honorable Speaker.
2 weeks it is. Thank you. Honorable members, in respect to response to statements, I have been informed by the Chair, Committee on Administration and Internal Security, that questions by Adan Kainan, Eldas, Danson Mwashako Undanyi, Farah Sala Fafi, and Ariko Namoit were discussed between the committee, the ministry, and the questioners, and that the honorable members were satisfied with the outcome. So we'll rest those there. And I invite the Chair Health to respond to a question by Irene Mayaka, nominated MP, on lack of facilities specializing in treatment of endometriosis. Yes, Tongoyo? I thought that's what you told me.
Being, of course, these are documents of the House, I table with the clerks.
Those who raised questions can look at them. Yes, Oundo?
Thank you, Honorable Speaker. During the same session, Honorable Speaker, I represented Honorable David Ochieng in respect of a question about abduction, and the question was insufficiently answered and the cabinet secretary promised to furnish additional information. So I thought the chair will be kind enough to inform the House that the question was not adequately answered. More information is required so that we can put the matter to closure. Thank you, Honorable Speaker.
Yes, Tongoyo, when can you bring additional information, either to the House or directly to the member?
I think I could follow the same suit because the only bit that was remaining was the minister to furnish the updated number of deaths, and that is why I have not included with what I had submitted with the clerks.